Now to COVID, as we're seeing another uptick in cases.
Yeah, at the peak of the Omicron wave back in January, we saw more than 1 million infections every day. That was at our peak. Well, now that daily number is now just about 96,000, but it is on the rise.
Yeah, so here to put this in perspective is NBC senior medical correspondent Dr. John Torres. Thank you for coming in.
You bet.
Again this morning. So let's talk about it a little bit. So COVID positive cases are up, deaths are on the rise again. But I guess if we put it in perspective, it's not doom and gloom, but it's still something we need to pay attention to.
It is, and it's something we need to pay close attention to because those numbers are rising. Like you mentioned, cases are going up, hospitalizations are going up, deaths are going up, unfortunately. But what's happening here is we know Omicron isn't as dangerous as Delta was back a year ago or so. But we do know that as the numbers go up, those other numbers of hospitalizations and deaths will go up as well, and so they need to be protected. The bottom protection is getting the vaccines and the boosters like you're supposed to get them at those stages, and then in the fall they're talking about producing a new booster that actually has an Omicron variant in that, so that's going to help as well. And then bringing back the masks. That's the big issue of contention right now.
That.
And so,
to be clear though, we're still, in terms of deaths, not to minimize death, but we're talking about 200 a day, 200 deaths a day.
Right around 300 a day. Yeah, and if you look at what's happening, I look back a month ago. A month ago, we were essentially the same thing. Right now, we're about 300 deaths a day, 300 deaths a day about a month ago. 100,000 cases a day around there, 100,000 cases a month ago. So the problem is it's plateaued out and hasn't come lower, which that's the first time we've seen that, because usually after a couple weeks, it drops significantly.
The folks who are dying, what do we know? I mean, has that changed at all, or is it still roughly the elderly and those with the underlying conditions?
And that has not changed. It's still the elderly, those with underlying conditions. And they're starting to see unvaccinated as well get into trouble with the serious illness, hospitalizations, and deaths. And so
Paxlovid, we understand pharmacists can prescribe it now, antiviral, but there's a catch.
That's the new.
Well, just really quickly, for people who don't know, so if I have COVID, if I'm okay, then I wouldn't take Paxlovid. But if I'm having severe symptoms, is that when you go and ask for it?
Right, that's when you go and ask for Paxlovid to make sure that you stay out of the hospital. That's its claim to fame. It's an antiviral medication, but there is a bit of a catch because what they said is, they know people are having troubles going to the pharmacies and getting their doctors to prescribe it. And so they said pharmacists can prescribe it, but the catch is the pharmacists have to have access to your medical records. They have to have either your medical records and certain blood tests because they have to know if your kidneys and liver is working well. And if they don't have those, they can call your doctor. And the big question is, well, what if I don't have a doctor? In this case, it's probably not going to help you a whole lot. You're probably going to need to go to somebody to get that prescription. So it's another tool in our tool bag just to help us out.
If you have kids over the age of 5, because I know the vaccine was just approved for kids under 5, is it time for them to get a booster?
So, over the age of 5, they can get a booster. Anybody over the age of 5 can get a booster. And we have a graphic of the boosters and when you can get them because it's very complicated. So booster number 1, 5 months after you get your second dose, everybody 5 and older. Booster number 2, it's 4 months after you get that first booster, and that one they're reserving for 50-year-olds and those who are immunocompromised. And so, again, it can be kind of complicated, but that's, remember back in the day.
It's pretty complicated. That was a lot of information to digest. We'll put it on the website for folks who maybe didn't catch all of that. Long COVID, my wife is one of the folks who suffers from long COVID. Have we learned anything more about it, or is it still a bit of a mystery?
It's still a bit of a mystery, but we are learning more as time goes on. One of the things we're learning is, unfortunately, is more and more symptoms are coming along with long COVID, and so people are reporting different kinds of symptoms, including like skin peeling, those types of things that we hadn't heard about before. The other thing is, it seems like the more times you catch COVID, the more likely you are to get long COVID, and so protecting yourself from getting it is important. On the good side of the news, it seems like Omicron doesn't lend itself to long COVID as much as Delta did, and so that's the good part of all this. But again, you want to make sure you protect yourselves. Masks, I carry it with me. I wear it everywhere I go that I'm around crowded people.
Wear it?
I still wear it. I'm one of the few. I wear it on the airplane. I wear it in the subways. I wear it if I'm around people that are crowded. And so, the other thing, too, is the graphic showing us there is if you are exposed, if you do test positive or you have symptoms, you need to isolate yourself. Remember the isolation rules. And you can go to the CDC site. They actually have an isolation calculator because it's pretty complicated. If I was testing positive today, today's day 0, I have to go 5 days beyond today, which means I get out of isolation next Wednesday. And so you can go to that calculator and it can help you calculate isolation and the quarantine guidelines.
Thank you, Dr. John.
That's good.
Lots of information.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.